A retrospective analysis done in 1,027 patients diagnosed with multiple myeloma in a single center showed that 73% of them presented with anemia, 58% of them presented with bone pain, 48% of them presented with elevated creatinine, serum creatinine, and only 28% of them presented with hypercalcemia at their initial presentation. Multiple myeloma is a neoplastic proliferation of the plasma cells. So these plasma cells, they proliferate in the bone marrow and can result in extensive skeletal destruction. So we can understand the multiple myeloma defining illnesses by the CRAB acronym. So C stands for hypercalcemia. Hypercalcemia meaning the serum calcium more or equals to 11 mg per deciliter. So it can occur due to multiple myeloma induced bone demineralization, which can further result in the osteoporosis and pathological fractures. So R stands for renal failure. So renal failure is characterized by the increased serum creatinine of more or equals to 2 mg per deciliter. There are multiple mechanisms why renal failure occur in multiple myeloma. The most common one is the light chain proteinuria, or what we call the Benz-Jones protein proteinuria, which can result in this light chain nephropathy. Another reason is hypercalcemia. Another reason is recurrent UTI. The patients with multiple myeloma, they are immunocompromised and they are prone to infection, so they develop recurrent UTI, which can further damage the kidneys. Another cause is drug-induced kidney damage, because the patients with multiple myeloma, they have chronic pain, chronic bone pain, so they are dependent on NSAIDs for pain control, which can further result in renal failure, because NSAIDs, they are notorious for causing renal failure. So A stands for anemia, and anemia is defined by the hemoglobin of less or equals to 12 gram per deciliter, and it can be caused by various mechanisms like the bone marrow replacement by the plasma cells, relative erythropoietin deficiency because there is renal failure, and because kidneys are responsible for producing erythropoietin, so relative erythropoietin deficiency can also lead to reduced hemoglobin and anemia. B stands for bone pain. So bone pain is caused due to the multiple myeloma induced demineralization, as we already talked about in hypercalcemia, which can lead to osteolytic bone disease and can further lead to bone pain and even pathological fractures in the long run.